Are you over 60 years old? You might be doing one small thing every day without realizing that it's making your brain most vulnerable while you sleep. No warning, no pain. Then the next morning you wake up unable to speak clearly, your arm won't move, or you can't stand steadily. I'm a neurologist. Throughout my career, I've seen far too many patients end up in that condition, even though they didn't smoke, didn't eat poorly, and exercised regularly. So what's the problem? Vitamins. It might sound strange, but the truth is, many older adults take supplements to support bones, boost memory, or improve energy. Some of them are genuinely helpful, but a few others, especially if taken in high doses or at the wrong time, can increase the risk of stroke or brain bleeding. You won't usually hear this from product labels or supplement sellers, but I see it in the emergency room. And you might be taking those very same vitamins without realizing it. Vitamin D, E, B6, A, and niacin. Familiar names, right? They're everywhere in pharmacies and health stores. Today, I want to share with you 5 vitamins that may pose serious risks to your brain health, especially during the early morning hours when the brain is at its most vulnerable. But before we get into that, I have a question for you. Have you ever wondered, could the vitamins I'm taking actually be harming me? If that question has ever crossed your mind, comment 1 below. If this is completely new to you, comment 0. And if you, or someone you love, are trying to protect long-term brain health, please like this video and subscribe to The Elderly Way. It's where we share science-backed advice made specifically for older adults, clear, honest, and practical. Vitamin D, a friend or a foe to your sleep. Vitamin D is one of the most commonly used supplements among older adults, and for good reason. It helps the body absorb calcium, maintain bone density, support the immune system, and improve mood. But here's what most people don't hear enough. Those benefits only matter if your body is truly deficient in vitamin D, and you're taking the right dose, at the right time, in the right way. Older adults tend to store more vitamins than younger people. As we age, the liver and kidneys slow down, and our ability to metabolize nutrients declines. Combine that with multiple medications or the common mindset of the more the better, and the body can easily become overloaded without showing any obvious warning signs. I once encountered the case of Alina James, a 71-year-old widow living in Michigan. She was health-conscious and had read an article saying that vitamin D helps prevent osteoporosis and boosts immunity. She went to the pharmacy and picked up a bottle of 5,000 IU vitamin D tablets. No one asked for a blood test. She didn't consult her doctor. She did what many people still do. She took 1 pill every night after dinner. About 2 months in, she started feeling mildly nauseous, with a dry mouth and occasional early morning fatigue. One morning, as she got up to wash her face, she felt dizzy, her left arm went limp, and she couldn't finish a sentence. Thankfully, a neighbor rushed her to the ER. The diagnosis: a minor stroke, high blood calcium levels, arterial stiffness, and abnormal blood pressure spikes during sleep. No one initially suspected the daily vitamin D pill. But when the doctor reviewed her supplement routine and medication history, the picture became clear. What most people don't know is this. Vitamin D helps the body absorb calcium, but if you're taking too much without needing it, calcium won't go into your bones. It builds up in your bloodstream instead. Over time, it can stick to your artery walls, cause atherosclerosis, reduce elasticity, and raise the risk of blood clots. These changes happen silently, no pain, no symptoms. But one night of dehydration, some restless sleep, and a sudden early morning blood pressure spike, and the result could be a stroke. Another overlooked factor is when you take it. Many people take vitamin D at night without realizing that nighttime is when hormones and blood pressure shift. Taking vitamin D during this time can raise blood calcium levels exactly when the brain is most vulnerable, between 3 a.m. and 6 a.m. On the other hand, taking it in the morning aligns better with your body's natural rhythm and improves absorption and effectiveness. Today, Many over-the-counter vitamin D supplements are shockingly high in dose, 2,000, 5,000, even 10,000 IU per pill. Meanwhile, the recommended daily intake for people over 65 is just 600-800 IU day, and only if a true deficiency is confirmed by a blood test. Taking high doses for a long time without monitoring is a recipe for metabolic issues, and in cases like Alina's, a stroke that no one saw coming. So, if you're taking vitamin D, stop and check these three things. How much are you taking each day in IU? Are you also taking calcium or heart medications? When was the last time you had a blood test to check your vitamin D levels? No one's saying you shouldn't take vitamin D. But at this age, you need to understand, more isn't better, and not everyone needs it. If you truly do, take it in the morning under your doctor's guidance and get tested every 6 to 12 months. If you're currently taking vitamin D and unsure about your dose or timing, drop a D in the comments. What you share might help someone else protect themselves better. And if you found this information helpful, don't forget to like and subscribe to The Elderly Way, where we put truth, experience, and sustainable health for older adults first. Vitamin E, heart helper or brain bleed risk. For many people over 60, vitamin E is considered an essential part of their daily supplement routine. It's often promoted as good for the heart, boosting circulation, improving skin, and enhancing memory. But what few people are warned about is that when used incorrectly or combined with cardiovascular medications, vitamin E can have serious consequences, especially bleeding in the brain. I once encountered the case of Mr. Glenn Patterson, 76, a retired civil engineer from North Carolina. He had a mild history of atrial fibrillation and had been prescribed the blood thinner apixaban to prevent blood clots. His health indicators were stable, and he kept up with regular checkups. But after chatting with an old friend, he heard that vitamin E could clean out the arteries and help with memory, so he bought a bottle of 400 IU capsules on his own. No one in his family knew, and he didn't mention it to his doctor because he thought, it's just a vitamin. After nearly a month of taking it, he started experiencing dull, persistent headaches. One morning he suddenly became dizzy, had blurred vision, and felt nauseous. At the hospital, an MRI revealed a small brain hemorrhage caused by a burst capillary that couldn't properly clot. His blood pressure was normal, and there had been no trauma or falls. But the combination of a blood thinner and high-dose vitamin E had made his blood too thin, raising the risk of internal bleeding. And this time, it happened in his brain. High doses of vitamin E can act as a natural blood thinner. It slows down platelet aggregation, making it harder for blood to clot. This becomes a clear danger if the person is already taking any kind of anticoagulant, from daily low-dose aspirin to Plavix, or more potent drugs like warfarin, rivaroxaban, or apixaban. Many people don't realize that the recommended daily intake of vitamin E for adults is only about 15 mg per day, which is roughly 22 IU. Yet most over-the-counter capsules contain 200, 400, even 1,000 IU, 10 to 40 times the actual need. And many people take them every day for years without symptoms, until one weak blood vessel in the brain finally gives out. Mr. Glenn was lucky. The hemorrhage was small and didn't leave him with any lasting motor issues, but he did experience temporary memory loss and had to stop all physical activity for several weeks. More importantly, he had to eliminate all non-prescribed supplements and undergo regular neurological monitoring to prevent recurrence. This isn't a rare story. In clinical practice, I've seen many older patients take vitamin E without ever considering drug interactions. Some took it because friends recommended it, others because they read about it, and most simply assumed that vitamins can't hurt. But the truth is, the older you get, the higher the risks from uncontrolled mixing of medications and supplements. Modern cardiovascular drugs are highly effective, but also highly sensitive to anything that affects blood clotting. Even one seemingly harmless vitamin pill can be the drop that spills the cup. If you're on medication for heart disease, blood pressure, or anticoagulation, the first thing you should do is check the label on your vitamin E if you're taking one. And if you've never discussed vitamin E supplementation with your doctor, now is the time to do it. Your safety doesn't come from taking more. It comes from understanding exactly what you need and what you're putting in your body. If you've ever taken high-dose vitamin E or are combining it with heart medication without checking for interactions, leave the letter E in the comments to help start an honest conversation. And if you found this information helpful, please like and share it with others who are at an age where every pill they take deserves extra care. Vitamin B6. When nerve support ends up harming your nerves. On the labels of many dietary supplements, vitamin B6 often appears alongside phrases like brain booster, nerve support, energy enhancer, or mental focus. Many older adults see these claims, hear friends recommending them, and assume it's a safe, maybe even essential choice. The truth is, vitamin B6 is an important nutrient. It supports nervous system function, helps metabolize protein, and plays a role in cellular energy production. But what most people don't know is that taking high doses of vitamin B6 over a long period can actually damage the peripheral nerves. A slow, silent kind of injury that in some cases can't be reversed. I still clearly remember the case of Linda Hooper, a 73-year-old woman from a small town in Iowa. She used to work as a secretary, and after retiring, she lived with her daughter and helped care for her young grandchildren. One day, she came to my clinic complaining of a constant tingling sensation in her feet, like tiny pins pricking her skin. The feeling had started to creep up toward her knees. She also said her grip was weaker. Her hands sometimes trembled, especially when pouring water. At first, she and her daughter assumed it was due to spinal degeneration or just aging. But during her physical exam, including motor and reflex tests, I saw clear signs of symmetrical peripheral nerve damage, a hallmark of B6 toxicity. When I checked her medicine cabinet, I found she'd been taking a brain and circulation support supplement she'd bought online. Each pill contained 100 mg of vitamin B6, and she'd been taking 2 pills a day, as instructed, 200 mg daily. That's more than 20 times the recommended amount for older adults. And she had been doing this for nearly a year. Unlike some water-soluble vitamins like C, excess vitamin B6 doesn't just get flushed out. It tends to accumulate in the body over time. In older adults, the body's ability to process and eliminate it slows down even more. The result is that the protective myelin sheath around the nerves gradually wears away, disrupting nerve signals. This leads to numbness, loss of sensation, muscle weakness, and in many cases, balance issues and motor dysfunction. What's more dangerous is that the symptoms develop slowly. They're easy to confuse with common aging problems like arthritis, vertigo, or mild cognitive decline. That's why many people don't realize what's happening until the damage is already done. Thankfully, Linda came in just in time. We immediately stopped all unnecessary supplements and referred her to a rehabilitation specialist. After a few months, her symptoms eased somewhat, but some sensation in her feet never fully returned. She no longer felt safe driving and had to start using a cane for longer walks. Let me be clear, vitamin B6 is not bad. It's necessary, but only in small doses. For adults, just 2 to 10 mg per day is enough, and most people already get that through a normal diet: whole grains, bananas, fish, eggs, potatoes. If you're not deficient, you don't need extra. Yet many brain-boosting or energy-enhancing supplements on the market contain 50, 100, even 200 mg of B6 per pill. Flashy labels, easy to buy, easy to swallow, but not at all safe for long-term use. And very few people would guess that a vitamin marketed as good for your brain could actually destroy your nervous system. If you're taking any supplement that says brain, energy, or nerve support, I strongly urge you to check the ingredients label today. And if possible, ask your doctor what dosage is appropriate for you. No pill is harmless when taken incorrectly, not even a vitamin. Have you ever taken high-dose B6? Or do you know someone who's had similar symptoms? Type B6 in the comments and share your story. Just a few words from you could help someone else avoid a dangerous path they never even knew they were on. Vitamin A, good for your eyes, but can harm your brain if used incorrectly. Many older adults believe that vitamin A is one of the safest vitamins. It's commonly associated with vision, immunity, healthy skin, and sometimes even anti-aging. It's true that vitamin A plays a role in those functions. But what very few people realize is that taking high doses of vitamin A over a long period can lead to a condition that even doctors may miss. Increased intracranial pressure, a serious issue that can mimic a stroke and directly affect vision and neurological function. I once encountered the case of Elaine Parker, 75, a retired accountant living in California. She was meticulous, loved taking care of her skin, and took pride in staying independent well into her 70s. For 4 years, she consistently took one eye and skin beauty supplement every night, along with a multivitamin every morning. No one in her family was concerned. Everything she was taking was just vitamins and all natural. Until one day, she started waking up with headaches, had mild blurry vision when reading, and occasionally felt dizzy when standing up. At first, she thought it was just from lack of sleep. But one morning, she began slurring her speech and her facial expression became uneven. Her daughter rushed her to the ER, fearing it was a stroke. Imaging results showed no blood clots, no bleeding, but abnormally high pressure inside her skull. Her cerebrospinal fluid wasn't circulating properly, and small blood vessels in her brain were being compressed. The cause: her blood levels of vitamin A were double the safe limit. Doctors diagnosed her with chronic vitamin A toxicity, leading to a condition known as pseudotumor cerebri, or false brain tumor. Unlike water-soluble vitamins like B or C, vitamin A is fat-soluble, meaning it doesn't flush out easily. Instead, it accumulates in the liver, fatty tissues, and even the central nervous system. When you're young, your liver can handle the excess relatively well. But after age 60, liver and kidney function gradually decline, slowing down the elimination process significantly. That means if you take too much vitamin A, even without going over the daily limit, but consistently for months or years, your body can build up dangerous levels without showing early symptoms. In Elaine's case, her daily intake from the two supplements added up to nearly 9,000 IU of vitamin A, while the recommended safe limit for older adults is only around 2,500 to 3,000 IU per day, and only when truly necessary, under a doctor's supervision. Most people don't realize that common multivitamins already contain the full recommended amount of vitamin A. Adding extra skin, eye, or anti-aging supplements can easily double or triple the dose, without anyone realizing it. Vitamin A toxicity doesn't cause dramatic symptoms at first, but the consequences can be serious. Headaches, blurry vision, double vision, dizziness, nausea, speech difficulties, and in chronic cases, permanent vision loss or cognitive decline. What's worse is that most supplement labels don't include clear warnings, and many consumers believe that vitamins can't be harmful. Elaine is now slowly recovering. She stopped taking all unnecessary supplements, goes through balance therapy, and gets eye exams every 3 months to monitor intracranial pressure. But she still needs help reading, and she can no longer go out on her own like she used to. She once told me, "I just wanted to keep my eyes sharp for a few more years. I didn't know I was putting my brain at risk just from taking the wrong dose." If you're taking vitamin A, whether from multivitamins, eye health pills, skin supplements, or anti-aging formulas, Review the total dosage across all products you use. And if you've never had a blood test to check your vitamin A levels, especially if you've experienced persistent headaches, blurry vision, or unexplained nausea, it's time to talk to your doctor. Type A in the comments if you've ever taken vitamin A or aren't sure whether you might be overdosing. And if you think this information could help someone, a loved one, a friend, or even yourself, please like and share. Niacin, good for cholesterol but potentially dangerous for the brain. Niacin, also known as vitamin B3, is often seen as a natural way to improve cholesterol. Many older adults take it after hearing that it supports circulation, boosts heart health, or even helps reduce fatigue. Some doctors used to prescribe niacin as part of treatment plans for lipid disorders, and you can easily find it in heart health supplements, fortified cereals, and even energy drinks. But there's a lesser-known side to niacin. At high doses, it can cause serious blood pressure fluctuations, stress the heart, disrupt cerebral blood vessels, and in some cases, trigger a stroke. I once treated a patient named Daniel Reed, 80 years old, who lives in Arizona. He was a retired mechanic, generally healthy, with no known heart disease. Recently, he'd felt a little winded climbing stairs and wanted to protect his heart. He read on a health blog that niacin naturally cleans out cholesterol. Without consulting his doctor, he bought a heart health supplement containing 1,000 mg of niacin per pill. Following the label instructions, he took 2 pills a day, 2,000 mg total per day. After about 3 weeks, he started experiencing facial flushing every morning, heart palpitations, and occasional dizziness when standing up. He and his son thought it might be due to his blood pressure medication. But one morning, he suddenly started slurring his speech for a few minutes, with one side of his face slightly drooping, then recovering. His family rushed him to the ER. Diagnosis: a transient ischemic attack TIA, a minor stroke, and a warning sign of possible permanent brain damage if left unaddressed. When we reviewed his risk factors, tests, and imaging, there were no signs of clots or severe atherosclerosis, but an abnormally high level of niacin was found in his blood. The doctors pinpointed the cause: the supplement he had been taking daily. Here's how it works. Niacin causes strong vasodilation, especially in the face and neck, which is why many users feel a flushing sensation. But after the dilation comes a reflex vasoconstriction phase, which can lead to blood pressure swings. This cycle repeats daily, making the heart work harder and throwing off the brain's blood flow. In older adults with already fragile vessels, that's more than enough to trigger a TIA, or worse, a full-blown stroke. Many older people take niacin without knowing the exact dose. Some products are labeled flush-free or extended release, which makes users think they're safer. But in reality, these forms can still raise blood pressure, cause arrhythmias, and affect blood sugar levels, especially with long-term unsupervised use. The recommendation for older adults is clear. Do not exceed 50 mg of niacin per day and only take it under clear medical guidance. Below that level, niacin is still found in many natural foods like salmon, tuna, peanuts, sunflower seeds, and whole grains, much healthier and safer options. After stopping niacin, Mr. Daniel stabilized. There was no permanent brain damage, but he had to change his habits, monitor his blood pressure regularly, be more cautious with any supplement, and always check with his doctor before adding anything new to his regimen. He once told me, very honestly, "I had no idea I could hurt myself just by trying to take care of my heart. I thought I was doing the right thing." If you're currently taking niacin, whether in a supplement or in a product labeled supports heart health, raises good cholesterol, or boosts energy, check the dosage carefully. Don't just look at the front of the bottle. Turn it over and read how much niacin is in each serving. And if you have a history of high blood pressure, heart disease, or are taking antihypertensive medication, it's important to talk to your doctor before continuing. Are you taking something that contains niacin and not sure about the dosage? Type B3 in the comments. And if you think this information could help someone you know, a parent, partner, or friend your age, share this article. One simple action could prevent a major health event. So in the end, what should you drink? Or better yet, what should you eat? After hearing about the 5 vitamins that seem harmless but can quietly harm your brain, you might be wondering, what should I take to protect my health? Or should I just stop everything and eat properly instead? That's a very practical question. Because your body, especially after age 60, doesn't need more supplements. It needs to absorb the right things, the things it recognizes and can use efficiently. The answer doesn't come in a capsule. It's right there on your plate. Let me share a real-life example, Mr. Charles Benson, age 77, a former carpenter in Texas. When I met him, he was taking 9 different supplements every day, each one for a different purpose. Bones, heart, memory, blood pressure, all labeled natural and for seniors. But strangely, he still felt tired in the morning, unsteady on his feet, and his blood pressure remained erratic, even while taking medication. We reviewed everything together, and we decided to do something many people are afraid of. Stop all supplements for 1 week, then slowly reintroduce only what was truly necessary, if anything. Instead, he started a simple, carefully planned breakfast. 1 steamed egg rich in protein, easy to digest. Half an avocado, healthy fats for brain and heart. 1 slice of whole grain bread helps stabilize blood sugar. A handful of berries like blueberries or strawberries, anti-inflammatory, protect brain cells. A glass of warm water to rehydrate after a long night's sleep. That's it. No capsules, no miracle powders, just real food. 3 weeks later, Mr. Charles came back and said, "I'm not dizzy anymore. My blood pressure's stable, and I sleep better than before." Why did this work? Because your brain doesn't need high doses. It needs the right amount, from sources your body knows how to handle. Water to carry nutrients where they're needed. Healthy fats to maintain the structure of nerve cell membranes. Slow-burning carbs for steady, long-lasting energy. Micronutrients from whole foods, not concentrated extracts. Here are some brain and age-friendly food groups. Dark leafy greens like kale and spinach, rich in folate and vitamin K. Fatty fish like salmon and sardines, high in omega-3s. Berries, anti-inflammatory, memory boosting. Seeds and nuts packed with vitamin E, magnesium, and healthy fats. Whole grains support blood flow and help regulate blood sugar. These foods don't just support brain function, they also protect your heart, reduce joint pain, stabilize mood, and help keep you physically active. All of which are keys to staying independent as you age. Final message. At a certain age, you can't just assume everything will take care of itself. You have to take control. You don't need to fear vitamins, but you do need to know what you're taking, why, and whether you really need it. A 70-year-old body doesn't process pills like a 30-year-old one. Even a habit that seems harmless can have consequences if you're not paying attention. Read labels carefully, ask your doctor again, and don't ignore anything that feels off, especially if it keeps happening. If anything in this video made you reconsider even one small thing, I consider that a success. Leave a comment. The first thing I'll change starting tomorrow is hit like if you think this content is worth sharing. And don't forget to subscribe to The Elderly Way for trustworthy information made specifically for older adults to help you stay healthy, independent, and sharp every day. You're not alone, and it's never too late to start over the right way.